This is why you shouldn't ice your injuries. In 1978, Dr. Gabe Merkin came up with the RICE method: rest, ice, compress, elevate. While this approach has been used for many years, in 2013, a study came out that disputed the effectiveness of ice with injury. In 2015, Dr. Merkin even renounced the RICE method, saying it's not as effective. Even though ice can decrease pain in the short term, in the long term, it's going to take longer to heal. It's going to reduce your blood flow and your inflammation coming to the injured tissue. That means you're not going to have as much nutrients coming in and not as much waste going out. So now instead of rice, we have peace and love. For the first few days, we want peace. To protect, you'll want to reduce the load that you place on that injury. For elevation, it's still smart to bring the limb above your heart to encourage waste products to move from the injured area. For avoidance, we want to get away from anti-inflammatories. As we already talked about, inflammation is a natural part of healing. To compress, we can use elastic tape to reduce the swelling while still allowing for necessary movements. And finally, for education, we're huge on teaching how much to move, when to move, how to strengthen, and what kind of treatment we can provide for your time frame of healing. Just because we want to protect the injury does not mean that we want to immobilize it. So even with an acute ankle sprain, we still want to keep it moving as much as possible as long as we keep that pain threshold below a 4 out of 10. Once the healing's progressed, we're going to slowly reintroduce load. We're going to trust the process with optimism. We're going to reintroduce blood flow with cardio, and we're going to stabilize the joint with rehab. So essentially, we've replaced ice with motion. That's why we say movement is medicine or motion is lotion.